For most people, tiredness is not a sleep problem. It's an energy production problem. And those are two completely different things. Wait 90 minutes after waking up before your first caffeinated coffee. Your adrenal system will thank you.
WhatsApp the word sleep to 072 702 1702 and we'll send you the link to watch the full video on Prime Media Plus.
This is CapeTalk. CapeTalk.
In Health and Wellness today, I want us to explore the topic of obstetric violence, which is when a woman is treated with abuse or neglect during her pregnancy and childbirth journey and immediately thereafter. And that can look like a lot of different things. It can include verbal abuse, physical abuse. It can include coercion into procedures that she didn't want done. It can even, as we've heard previously, lead to administering drugs or conducting procedures without the mother's consent. If you were listening just a couple of weeks ago, we shared with you the story of that book about the midwife who was actually imprisoned for administering labor-inducing drugs to her patients, having told them she was giving them rescue remedy, with dire consequences for both mother and baby's health. And, you know, it struck me after that interview, what was unusual about that story was not only how awful and prolific that abuse was, how long that particular practitioner got away with it. It was the fact that she was even brought to book at all, that people spoke up and reported her. Because the reality is that many women who experience disrespect, abuse, coercion during childbirth and postpartum care don't feel empowered to report it, don't necessarily even know that that should not have happened to them. And a recent study out of the University of Pretoria has suggested that black women in particular are disproportionately affected in this country. We're going to be speaking to the master's graduate who conducted that research. And I'm also in a few minutes' time going to bring in midwife Dr. Mmatshilo Motsei, who has recently published the most fascinating book called Ways of Being Born, which speaks directly to this issue. First, though, let me welcome Zilungile Silinda, who is a recent master's graduate of the University of Pretoria, who received a distinction for her work on obstetric violence. And Zilungile, we're so pleased to have you on the show this afternoon. Welcome.
Good afternoon, Pippa. Thank you so much for having me.
It's a huge pleasure. Zilungile, what made you want to explore this topic for your master's? I understand there's a very direct personal reason for it.
Yes, so unfortunately last year, my mother, who's a midwife, was diagnosed with cancer. And because of just the positionality and the dynamics at home, I became her primary caregiver. So I moved back to Mpumalanga from Pretoria to take care of her. And in my caring for her through her cancer journey, we spent a lot of time together and we were talking a lot. So she was like reminiscing a lot about her time as a midwife working in the public healthcare system. And she's worked for decades at the same hospital I was born at, same hospital she did her training. And she was just speaking through her experiences as a midwife, particularly during COVID, right? And I was at a point in the master's journey where I didn't really have a topic and I couldn't nail it down for some reason. And I think what I didn't understand was that I couldn't nail down the topic because I wasn't writing from my context. And I couldn't write because I wasn't writing from home. So the more my mother spoke about the sort of conditions that she herself as a midwife and the women were experiencing, the more I was hearing things such as structural violence, the more I was hearing structural neglect, the more I was hearing the consequences of what happens when there isn't any accountability in healthcare leadership. And also just I was hearing politics. It was a deeply, deeply political issue. So the more my mother spoke, the more the project came to life. And that's how I came to it.
Now, there may be some listeners for whom this term is an unfamiliar one, and they're not alone in that, because we didn't actually really have a term for it until relatively recently in history. I understand, I think it was Venezuela, our next guest is going to tell us, that first sort of coined the phrase of obstetric violence. But Zilungile, of course, the problem has been with us for a very long time indeed. Can we maybe, just as a way of helping those who are not familiar with the concept, give some examples, and maybe you can share some actual examples from the women that you interviewed as part of this master's of what forms obstetric violence might take?
Okay, so I think simply put, Obstetric violence is when a woman who is pregnant, in labor, giving birth, goes to a healthcare facility in order to receive reproductive or maternal health care. And instead of experiencing childbirth as an intimate moment of bringing life into the world, you instead experience childbirth as trauma, as violence, and you are met with treatment that doesn't amount to care, but rather you leave that space with physical, psychological, and metaphysical scars that take a lifetime to heal. So instead of birth being an act that is one that is surrounded by intimacy, one that is surrounded by ritual and care and family, it is one that is then enmeshed in many different ways in violence. And it's a kind of violence that isn't always overt. It's the kind of violence that can be verbal. It's the kind of violence that can be physical. It's the kind of violence that can come from there not being a bed available. You would hear stories of, not even stories, but these are lived experiences where women are giving birth on the floor. Women are denied something as simple as you've just given birth and there aren't enough resources to go around. The denial of painkillers. Yeah. So it takes those many forms, and oftentimes it's difficult to recognize it as violence because it's so institutionalized, so normalized, and so expected, especially in the case of Black women who are utilizing the public healthcare system because it's become so accepted that Black women have to give birth in the spaces of neglect and deprivation and control. And I think that would be a way to understand it.
Yeah, thank you so much. That's actually an excellent segue to bring in our second guest, if I may, who's joining us on the line. Dr. Mmatshilo Motsei is actually speaking to us from a midwifery conference today. She is the author of Ways of Being Born, Tracing the Footprints of Birth in Africa. She is herself a midwife as well as a social scientist who has an absolute passion for integrating clinical knowledge around childbirth with indigenous wisdom and birthing practice. And this book explores the question of whether this institutionalization that Zilungile has just mentioned is actually part of a problem of over-medicalizing the whole idea of birth. And this book questions whether in doing so we've lost touch with the sacredness, the ritual, the intuitive wisdom of how women have given birth over eons. Dr. Motsei, it's wonderful to have you with us on the show this afternoon. Thank you for joining us as well.
Hi. Thank you for inviting me. I'm joining from Bramfisher Airport, so there's a bit of background noise. I hope you can hear me.
We're hearing you loud and clear, but thanks for explaining the slight background noise. I don't think it's a problem. You've literally just come from a midwifery conference where I know this question of obstetric violence is one of many items that you would have been discussing.
Yeah.
Do you want to just give us hot off the press, how big a concern was it for those attending the conference?
So today, I don't know if you know about the study that Embrace did.
Yes.
On obstetric violence. Julie Hunter from Embrace came to present the findings of the study. And I was in the room when she was presenting, and I was kind of carefully watching body language in terms of how the midwives were responding to what she was sharing. And because I have also worked for a long time with survivors of sexual violence, gender-based violence and sexual violence, I saw the midwife responding in a way that people respond when there's serious discomfort, maybe starting to talk, even when the speaker was busy speaking or laughing or running to their phones. And obviously, it's something that they all know, right? But it's uncomfortable for them. But what is here in the second session, people were saying, this is not new. We all can relate to what was presented in the morning. We all do it, right? So we had to celebrate the fact that even though it's uncomfortable, it's out in the open now, and it can be addressed.
It's something you write about very frankly in your book when you say we all do it. To some degree, this has been normalized in training. And let's talk a little bit about why that is. Maybe it's a factor of the sheer mass of patients, the workload, the stretched resources in the public sector, that there is there's demand for a quick turnaround. As soon as one patient has delivered, there is another waiting to be helped, or more likely both simultaneously needing the assistance. The resources are not there to provide the level of care you would want to for all of them. Do you want to comment about that? Because it was very interesting to read in your book how you did a lot of sort of self-reflection on, I've been part of this myself as a midwife.
Yeah, we start off with the training, right? Imagine me as a young person going into nursing and midwifery, and then all I'm taught is the biomedical model of childbirth that views the woman's body as a machine and giving birth as a medical condition. So I am not taught to kind of see that unconsented interventions, coercion is a form of abuse. And when I did the research and compared what's happening in the clinical setting with what the elders in the village are saying, there's many of the women that I have interviewed who've never set foot in a hospital to give birth for that same reason, because they hear that there's abuse. When I compare the two, the elders were clear. A woman who's giving birth is not supposed to be alone. It's surrounded by a group of women. Someone at the back maybe supporting her, someone ready to catch the baby, the eldest one in the corner making invocations for the safe arrival of the child. So the mother is being midwifed as well at the same time. Because when birth happens, there's more than one birth happening. There's a baby that's been born. A mother is being born as well. There's a new identity emerging. And when we extend that even within the African indigenous knowledge system, there's an expansion of the lineage as well. So there is kind of many births happening at the same time. So today, my role in the Congress was like, ask a question. What happens to a midwife? How possible is it to give respectful care if you're a midwife who is working in a structurally violent institution? And what happens then is that you get numb over time. The body has a way of responding to trauma, even the trauma that you cause, in a way that you get numb, and just kind of get used to doing it. But what was fascinating today, when I left, is this is a topic that they have all embraced. Not all, but the majority of them embrace, and they are ready to kind of talk about, okay, my point of departure is you can't even address obstetric violence without decolonizing the curricula, because we are still using a foreign model of training. It's interesting that I did this in Bloemfontein, and the history of midwifery is traced to someone like Henrietta Stockdale, who was an Anglican nun who came here and started caring for the sick and started the first midwifery school in Kimberley. So I was tracing the footprint of Henrietta Stockdale to say, 115 years after her death, we have not changed the fact that the training is following the British model of training. So there's a lot, as you say, the sacredness of birth that we have lost in the process.
Just for anybody who's coming in midway to this conversation, two guests with us this afternoon. On the line, Dr. Mmatshilo Motsei, who is the author of Ways of Being Born, Tracing the Footprints of Birth in Africa, which is published by Jacana, by the way. And then via Zoom, Zilungile is also with us, and she is chatting to us about her master's project, Zilungile Silinda of the University of Pretoria, her master's project looking at obstetric violence in South Africa. And Zilungile, if I can come back to you here, our listener Tracy making a very important comment on the WhatsApp line, questioning whether the problem and the reason that so many women are having these violent experiences is to do with the nature of how people are coming into the profession of nursing in the first place. That what used to be seen as a calling for people who wanted to give care, wanted to help the vulnerable at their most vulnerable moments, that maybe that has fallen away and that it has become simply a job to be done. Do you think there is an element of truth in that question?
I think it's important that we have all of these different perspectives, and that's a great contribution because just as Dr. Motsei was speaking about the colonial lineage of nursing in South Africa and also just the biomedical model, and I think it's important to understand that the impetus that drives people into nursing, right? It's also important to understand that the broader social and political factors that drive people into certain professions, and also the conditions that people are met with when they step into these spaces, right? Because if you're working in an environment of absolute deprivation where you are having to make do and get by with the bare minimum when it comes to painkillers, the bare minimum when it comes to something as simple as hospital sheets, right? And PPE, safety gloves, that does take a toll. And I think psychologically and also just effectively, the kind of environment and the kind of work and organizational culture it breeds when the objective is to get people in and out as quickly as possible out of the labor ward. I do think that, as the contribution is mentioning, that there's so many systemic factors that we can't really limit it to the individual. And that's not to absolve people of wrongdoing. That's not to absolve people from their own individual parts in perpetuating harm. But I think it's also just to have a broader perspective of it and to also understand that accountability starts right at the top. Because if we're creating these sorts of conditions where health workers are unable to deliver care, and even in training, they are already prepared that you're going into an environment in which you are unable to deliver care. So then the priority shifts from delivering quality care to then preserving whatever minimal resources are there. That does create that kind of environment. So I think that's an excellent contribution, and I think it helps that we're having so many different perspectives today, because it helps us understand how multi-layered this issue is.
I also just have to say it's not only a public health institution issue. Just for the record, for those who missed our conversation 2 weeks ago about the book Undelivered and the story of the midwife Yolanda Maritz-Fouché, who is sitting in jail as we speak for her role in obstetric violence, that was playing out in the private sector, and there was a whole nother layer of difficulty around accountability because it was happening in the private sector. So it's not to say that this only happens in public sector hospitals or, in certain economic sectors, for example. It's a problem across across women's experience of childbirth in this country. Before we run out of time, Zilungile, just one last question for you. My understanding is, congratulations on doing so well with the Masters project. I believe that it has inspired you to want to carry on investigating this subject still further towards PhD level. Is that correct?
Yes, that is correct, Pippa. Thank you so much. So I am continuing with this work in my PhD, and I will be doing the work from the home context, which has been challenging in its own way, because in researching, I think, my own context, I have also been learning about myself. So I will be continuing with this work because I feel that it's important that we all start with where we come from. And just as you've mentioned, how it's not specifically a public healthcare issue, it's not specifically a private healthcare issue, but just in me continuing with the PhD, I just hope to continue to contribute to this very important conversation and actually start building towards real material change for women in this country.
Yeah. Thank you so much for joining us. Zilungile, Silinda speaking to us, their recent master's graduate from the University of Pretoria. And I must also just say thank you to Dr. Mmatshilo Motsei, who has joined the conversation by phone, the author of Ways of Being Born. Final question for you, Doctor, is really, in publishing this book, what sort of impact are you hoping it's going to have in terms of broadening the conversation about confronting the fact that this is happening and asking us to look perhaps back to the way things used to be and the way childbirth used to be approached as holding perhaps some of the solution?
Yeah, the book is not just about birth. Yeah. Birth is the entry point to show this is a book about a body of knowledge that has been lost. It's a book that traces how from time immemorial, women were not giving birth alone. Women were supported, and that even before the institutionalization of childbirth, the sacredness, I said earlier, the sacredness of birth was maintained. But another thing that is happening with this book, what I find amazing, is that it's not just read by researchers or practitioners. It's also attracting attention from young people. And I mean, I think the greatest surprise for me is like pulling attraction from young men, young black men who are interested in reading the book. And I think we are at a time where we have to start thinking, or I think we there's a phrase that says peace on earth. Someone was quoting, peace on earth starts with peace at birth. And when I heard that statement, I reflected deeply over it. And I think the society is aware now how deep the moral degeneration of society has got. And somehow birth seems to be giving us an opportunity, to not only heal generational traumas, but also to look at how we invite the soul and receive the soul into the world. Because we believe that birth is not just physiological or physical, it's also cultural and spiritual. So I'm amazed at a wide range of people who are reading the book, who are kind of ready to engage with it.
And I think you've done a very important thing in giving them the platform to engage. Dr. Mmatshilo Motsei, thank you so much for your time. And please look for Ways of Being Born in your nearest bookstore and online. It's published by Jacana Media.